that in Foxboro, we now are down to 14 active cases, which is great news. We've actually dropped 3 cases from yesterday. Since the beginning of the epidemic, we've had, which occurred starting on March 15th, we've had a total of 28 cases that have been determined to be positive. Of those 28 cases, 14 people have recovered. A total of 241 folks have tested negative for the virus, and currently we have 14 cases that are active. During that time frame, we've only had one person that was considered to be, that was actually hospitalized for the epidemic. So that's the latest information in Foxboro. And across the Commonwealth, and particularly in Norfolk County, there were currently 1,778 active cases that have been determined to be active in Norfolk County. The largest number is in Suffolk County, which is 3,600 cases, which is in and around the Boston area, and 3,545 cases lagging right just behind us up in the Merrimack Valley area. So that is that in the total cases within the Commonwealth is 1,690 cases. Total of 87,511 people have been tested at this time. 433 deaths have been associated with those cases in Massachusetts. Fortunate to say that no deaths have occurred in around Foxboro. There have been a few in the Norfolk County area, but none affecting Foxboro directly in that regard. So that is good news. And then yesterday I did have a request for information on an individual who had asked how the Doolittle home was doing, and the Doolittle home is doing well. In fact, they are doing very well. They actually have no cases to report. I spoke to the director yesterday, who called me, or reached out to me to let me know that good news, and so I'm happy to report that they are doing very well. As far as the area that is impacted the most, the age group is the age group of 50 to 59. That is 3,200 cases that are affected in that age group. 9.4% of the total, or 1,600 cases, have been hospitalized. 4,700 are non-hospitalized, and 10,500 cases are under investigation. 227 states of emergency have been declared throughout the Commonwealth. Take a look around New England and see what's happening in and around the New England states. Connecticut currently has 8,781 cases, 335 deaths. Rhode Island has 1,450 cases and 35 deaths. New Hampshire, 788 cases and 18 deaths. Vermont has 605 confirmed cases and 23 deaths. And Maine has 537 cases and 14 deaths associated with them. The biggest area in the country right now is New York, of course, at 151,079 confirmed, over 6,268 deaths. I know that yesterday was one of the worst days for deaths, though it does appear that the number of cases being hospitalized is starting to level off. That said, and this was Dr. Fauci who actually confirmed this information with Governor Cuomo, that while the cases do tend to level off at some point, the number of folks that will die from the COVID-19 epidemic will actually increase, and that's actually what happened yesterday. You could see that happening yesterday being the worst day so far. Michigan, just in and around the country, New Jersey has 47,437 cases. Michigan has 20,346 cases. California, 19,063 cases. Louisiana with 17,030 cases. Massachusetts is in the 5th category right now. We were 4th, but I know that Michigan jumped up recently, and so now we're actually in the sixth case overall, largest number of cases overall. Pennsylvania is actually closely behind us with 16,746. Florida has 15,698. Illinois, 15,078. We noted that yesterday that the middle part of the country, Detroit, Chicago area, Louisiana, those are the hotspots right now. In addition to, of course, New York City and areas in Massachusetts. So we will continue to keep you updated on that situation overall in terms of the numbers. That's the latest information on that front. Let me just take it. Let's go right to the report, today's report, and see what's happening on that front. Uh, so, uh, so we are. So the latest information that I have is. Bear with me as my reports downloading. I'm hoping that it would. And let me see. All right, so let's take a look at today's report. The state COVID-19 website has been redesigned with input from users. The site can be accessed from the Health Department COVID-19 page or mass.gov. And the website has frequently updated information and guidance on a wide range of topics related to COVID-19 and the state emergency. You can stay informed, get information from trusted sources such as www.mass/COVID-19 for the latest news, case counts, and lab testing results. You can call 211 with questions about COVID-19 and how it can actually be how it can actually be addressed if it relating to symptoms, etc. The text and the keyword COVID 888-777 to receive notifications to your phone. And really, another really important thing that I think most people are starting to feel the effect of this, and that is the emotional impact of what's been going on with the COVID-19 epidemic. And so folks can call 211 and choose the call to talk option, and folks will be able to get help directly from that. Samaritans is continuing operations 24/7 as always, and it can be during this unprecedented time, it can feel a little bit overwhelming to receive constant messages about COVID-19. So you can call the helpline at the 24/7 helpline at 877-870-4673. That's 877-870-4673. The disaster distress helpline is 1-800-985-5990, and has a 24/7, 365-day a year be able to help folks dealing with crisis intervention. So from the MRC, the Medical Reserve Corps, the coronavirus testing and response, there are 16,790 cases, confirmed positive cases in Massachusetts, 1,583 hospitalizations, and 433 deaths as of yesterday at 4 p.m. The data also is now available in a dynamic model on the mass.gov site. Over 87,000 tests have been conducted by the state public health laboratories. Between 4,000 and 6,000 tests are now being conducted. That's an increase of 1,000 tests per day, as was indicated when indicated yesterday. So the Department of Public Health has convened an advisory committee to make recommendations for crisis standards of care and planning for the possibility of the surge, creating difficult challenges for healthcare providers around the prioritization of certain types of care and equipment to patients. Although all stakeholders are hopeful that the preparation currently underway to expand capacity will make this guidance unnecessary, this is an important part of the planning process for pandemic response and has been requested by the medical community. This guidance is based on standards created by the University of Pittsburgh, and similar guidance has been adopted by other states. So it's obviously this is planning for the worst case scenario if in fact we do get the surge. That's been talked about, and we don't have enough equipment to go around. It's certainly cause some significant impacts and difficult choices to make for patients. There are now 2 mobile testing sites dedicated for public safety, one at Gillette Stadium, of course, and the other one is at West Springfield. These sites can test around 200 individuals per day and 7 days a week, and no charge, and appointments are scheduled. And appointments are scheduled through individual public safety departments and agencies. Mobile testing for long-term care facilities, including nursing facilities, continues to operate around the Commonwealth. As of today, the mobile units have visited 126 facilities across Massachusetts and conducted close to 2,000 tests during that process. DPH has also started a nursing home family resource line for those who have loved ones in nursing homes to get the latest information and resources and answers to questions related to COVID-19. The number is 617-660-5399. It is open 7 days a week from 9 a.m. to 5 p.m. Unemployment and worker assistance. As of yesterday, there was no new information about when the self-employed individuals can submit applications for unemployment assistance. I know that we were able to help a young person to receive assistance with their unemployment benefits. Reached out to the state senator's office, State Senator Paul Feeney, and to State Representative Jay Barrows, and both were helpful in trying to help this person get their claim activated and put in place. The economic impact stimulus checks to individuals are expected to begin this week, so by the end of this week, by tomorrow, we should be seeing some of those start to come out. I would think by early next week at the latest. For many individuals, changing circumstances have led to rapid changes in healthcare coverage, needs, and insurance status. Massachusetts Health Connector is available to answer any questions and provide resources about health insurance options, and has created a dedicated COVID-19 page to answer questions, common questions, and provide information about important deadlines. The Associated Industries of Massachusetts will conduct a free question and answer webinar for businesses to speak with experts on COVID-19 impacts, and that's at 11 a.m. today. If folks want to reach out to the Associated Industries of Massachusetts webpage, they can get that information about that. And the Massachusetts Cultural Council has opened applications for grants to artists and artist-related workers who have been impacted by COVID-19. Applications are being accepted online until April 22nd. Massachusetts Cultural Council has also conducted an online survey of economic impacts on cultural organizations during the pandemic. The survey is open until April 14th. With due respect to surveys, you can go on the Foxboro Twitter site and certainly fill out our local needs assessment, so that we can have a better understanding of what is needed in the community and how we can further expand our resources to you and helping you through the pandemic. And let me see. I think I've reported on just about all of these things so far, and please consider donating to the Mass COVID-19 Relief Fund to support organizations that provide key safety nets for people in Massachusetts hardest hit by the virus. Funds will be distributed through existing local nonprofits and community organizations, who will ensure that funds are used to maximum benefit in serving those most in need. And just let me check a few questions here. Taxes, the taxes due. That question is going to be dealt with by the selectmen at their April 14th meeting next Tuesday night. And right now it looks like the date of July 1st will be for property taxes will be moved to July 1st. So it is actually June 1st, not July, as one person had indicated. So that it is not officially changed as of this moment. That requires a vote of the Board of Selectmen, but that will be taken up by them at their meeting next Tuesday night. All right, just a couple other items that I wanted to bring to your attention. The Foxboro Discretionary Fund is a fund just for Foxboro residents that is available to help folks that could use some help during this epidemic and for other purposes. The discretionary fund, folks can send money directly to, or their donations directly to the Foxboro Discretionary Fund, care of P.O. Box 636, Foxboro, Mass. 02035. Again, that's the Foxboro Discretionary Fund, P.O. Box 636, Foxboro, Mass. 02035. And then also just another plug for the Eat in Foxboro. Hashtag Eat in Foxboro. If you go on the Uptown Happenings page, or the Uptown's Facebook Happenings page, you can check that program out. Certainly hoping to promote the use of local restaurants during the pandemic, and also that will be for takeout purposes only. I know that some relief was provided in recent legislation that allows folks that have liquor licenses can actually take an alcoholic beverage with them as part of that meal effort. And so that's so you certainly want to do whatever you can to help our local establishments to the best so they can stay in business and be ready to provide the full level of services once they um, once the pandemic is lifted and we can get back to normal life sooner rather than later. Anybody who is this program is this campaign in the Eden Foxborough campaign is scheduled to begin April 13th through May 1st. And so, if anybody has any questions about that, you can reach out to Renee Tocci at rtocci tocci at foxboroma.gov or visit www.foxbororec.com, and they can provide you information on that. What they're going to do is provide each week they'll provide two winners who receive a $50 gift card to a Foxborough resident by simply posting a picture on the Facebook or Instagram, make it public on of your takeout delivery from a particular Foxborough restaurant, and tag it with hashtag Eat in Foxborough. That's lowercase EAT, higher case IN, lowercase Foxborough FOXBORO, and the name and the hashtag name of the restaurant. Don't forget to make your post public, so that way they'll be considered to be part of the overall consideration for that $50 gift certificate. So thank you for that part of it. And again, I noted earlier that the Doolittle home had reached out to me yesterday, indicating that they are doing very, very well. They've had no cases since the pandemic began, and that was as of 4 o'clock yesterday afternoon. So good to be able to report that. So. So that I wanted to make sure that if anybody has any further information that they need, you can certainly reach out to me at Keegan at foxboroma.gov, and I will certainly try to include it the next day in the report. I know that somebody did reach out to me about that yesterday, and I just wanted to make sure that I've covered everything that I was going to cover, and I do believe I did. Just another reminder that the town's the composting facility is now open, and if you need to have stuff in your yard you want to get rid of, it is open from 7:30, I believe, that the 7:45 to 3:45 p.m. Monday through Saturday, weather permitting, of course. And the site actually opened on April 6th. And you can actually bring anything that you have from your yard as long as you are a Foxborough resident. So make sure you make sure you get that out. And household hazardous waste day has been canceled. So that's unfortunate, but we'll try and schedule for another day. Hopefully this summer we can get folks to actually continue to use that possibility to get rid of some of your hazardous waste. That the date has been canceled. And so we will not be doing it this, which I believe was usually scheduled for this week or next. So there's a number of things are still canceled. A lot of things we're still encouraging people to social distance as much as possible. The next week or so should be the surge week. So we'll hopefully get through this and hopefully get beyond this, and with fewer cases in Foxborough as the trend is starting to continue in that direction. Let's see if it stays that way. So until then, I will see you next time, which will be at 10 o'clock tomorrow morning with the latest update. I want you to continue to stay healthy, stay safe, and I'll see you next time.